Hello, everyone. Again, I'm coming with another interesting case which we have come across. Again, this was a case which was left to die. This is a lady of 61-year-old who came from a part of Tamil Nadu. Her cancer was in her ovaries. It's not just in the ovaries, it was there in their peritoneum and their adrenal glands and the vermindal and nodal meats. So it means it's all over her abdomen. And she came with a huge abdomen. Her abdomen girth was measuring around 102. And we have done a tapping on the first day that she came in the July of 2025. We have done a tapping on the 12th of July, where we have taken about 4,300 ml of uh, fluid, ascitic fluid was taken out from this particular patient. She had very much fullness of her abdomen, continuous vomiting. She was not able to eat, and she has not nearly lost around 8 kg of weight. So when she came to us, like her weight was around 61.7. After we removing her ascitic fluid, it was around 59.2. So again, this was an impossible case, and her surgeons and the oncologist told that she has only months to live, and the cancer cannot just go back. So on the July 12th, we have checked our blood markers. Always we check the vitamin D first. It was 22.7. Like everyone, the vitamin D deficiency is going to be a definite marker where it is predicting which direction your body is swaying in. And when I checked their homocysteine, it was 23.1, which is normally it should be around 10 to 15. So 23.1, B12 levels were 100. She had a very high level of ferritin, that is iron content is 192. LDH, lactate dehydrogenase, we'll be checking here. It was around 280. That means her body is producing sugar even in the absence of oxygen, because cancer cells can only divide in the deoxygenated state. And she's also having a higher parasitic immunity. Her IgE levels were 109. And also her CRP levels were 15.8. The cancer marker CA125, which is basically for the ovarian tumor, it was around 951 on the 7th July. Okay, so it's all over the peritoneum and radic nexa, and all the nodal meats were there, and ovaries were also swollen. So she has undergone treatment with us from July, and continuously now also she is under follow-up, and she achieved a remission rightly around um, on the 11th month. When we took her scans, there is no cancer in her body. And when we checked all the metabolic markers, and in between from the 7th month to 11th month, we have done tapping for her multiple times, around 3 times more we have done the tapping. Initially, we got 2000 ml, that is 2 liters. Then it reduced to 1200, that is 1.2 liters. And in between, we had an episode where the fluid raised up to 3200 ml. And after that, there was no ascites, there was no fluid formation in her body. And now, when we checked the scans, there are no cancers present in our body. And presently, today, on the last measurement, what we have done for our body, her vitamin D levels are 71.8. The homocysteine level is very well under control, 9.9. B12 level is 691. If you look at her CA125 level, it is 6.62. That is from 910, it came to 6.62. Alongside, we have also added drugs like nab-paclitaxel and carboplatin. We have been added with her, and bevacizumab has also been added to this particular patient. A combination of modern medicine and integrative oncology therapies like dietary correction, and alongside adding intravenous nutrition like vitamin C, ozone therapies, B12 infusions, zinc infusions, and of course oncothermia given for this particular patient has brought her back to life. She's normal, doing everything. She has put on weight like normally. Initially, she was losing weight. And today, when she came for the last follow-up in the 5th of November, she's weighing around 59.3. The stable weight from the beginning till now. There is no weight loss, no vomiting now. She's able to eat her food well and living a normal life. Again, this is not the end of the story. You need to continue with the same kind of dietary preparations as well as the intravenous nutrition as and when it is required. And also keep a close monitoring of your lifestyle, sleep, and other things also is very, very important. So imagine, without removing the ovaries, without removing the uterus, a high ascitic case from the beginning. In just a matter of 5 months, we were able to reverse this particular condition. Again, the credit does not go to the doctors. It goes to the metabolic correction, what we were able to do, and the receptiveness of the body and the mental health aptitude of the patient, and also the brilliant support from our medical oncologist who have given a low dose target therapy for this particular patient, where we are bringing the patient back to their life. So, none of the cancers are an end game. as I told earlier, 70% of tumors can be definitely reversed. 20 to 30% is a problem. But again, we can be a torture-free life and live normally. Stay tuned for more videos like this. Thank you.